Hi everyone, Dr. Nemechek here. I want to talk about the 5 sources of anxiety, or the 5 ways you can become anxious, and it helps you break down like how to deal with that. So one is just situational. It's valid anxiety. I would guess you could say somebody's pointing a gun at you or threatening you in some way, and then what you feel is you release a stress chemical called norepinephrine. This is known as your fight or flight hormone, and that's what gives you the fear, the anxiety sensation. Okay, so this chemical's, in a primitive sense, this chemical's supposed to be released when you're in the jungle and there's tigers around. Okay, makes you anxious, makes you fearful, might get a little aggressive if you think the tiger's close, might make you want to run, and so situations can do that. Now, some of the situations might not be so real as much as perceived. Like maybe there's some person next to you in the store that you're frightened by, but actually they're just a nice person. So it's just however you're interpreting your world around you. Another is kind of a unique kind of injury to the limbic system in the brain, and this happens with certain brain injuries. In particular, one is like when there's an explosion. So what happens is the concussion blast will kind of basically hit you like a fist in the face, but it's also like a wind that'll turn your head, and this biomechanical shift of a punch and turn can cause this injury in the limbic system, where now you're abnormally just leaking out the same fight or flight hormone, norepinephrine, all the time. Sometimes you can have medications, like for instance, if you're taking an antihistamine like Claritin D, the D is a decongestant called pseudoephedrine that can make people anxious. Too much caffeine can make you anxious, other kinds of things. So sometimes medications or supplements can do that. Another probably very common one is bacterial overgrowth, and that's what I'm showing you here on the screen. Actually, your gut bacteria is supposed to be balanced in this way, where you have certain families of bacteria in the small intestine and then some in the large intestine. And then when you get what's called bacterial overgrowth, or SIBO, this has been shown in animal models to trigger a release of a lot of norepinephrine that makes them very anxious. The same thing happens in people. This is when people are thinking they have a nervous stomach, say before giving a speech or a sporting event or just some situation, people will get really nervous. They might have diarrhea or cramping or something like that. Actually, they don't really so much have a nervous stomach, implying like brain is causing the gut to be funny. It's actually the gut responding to the situation and releasing the chemical and making you feel nervous. So it's really, instead of nervous stomach, it's stomach nervous. Now this could easily be fixed with some rifaximin that we've talked about in our other videos. And then another one, and very, very common one, is damage to the autonomic nervous system. So this is the part of your nervous system that regulates all your organ function and your immune system and hormones and your blood pressure. And one of the most common things that will occur if people have a brain injury, and now I'm talking not necessarily serious where you bleed in the brain, but concussion or minor concussion type events, is that you don't have enough blood pressure in your brain. And if you don't have enough blood pressure in your brain, so your red blood cells, you breathe, you fill them up with oxygen, you got to push them at the correct pressure for that oxygen to flow into the neurons. And when you get an injury, the brain has trouble getting that maximal effect. And the brain is sensing this lack of oxygen. The brain's interpreting this like you might die. So the brain will release that fight or flight hormone, norepinephrine, because that'll boost pressure to your head. But now you've got, you're anxious, you're super nervous, people have run out of restaurants and they don't even know what's going on because they're just afraid. Like they think they're, the building's going to catch fire or something. And, if you have this, you often have other things like you might have headaches, chronic neck tightness, occasional little lightheadedness when you stand up. People often are thirsty or they crave salt or sugar. They're really fidgety. They may tap their foot a lot and bounce their knee, because that'll drive blood pressure to your head. So again, there's basically just every patient with anxiety. This is the list I look at. I look at true situational anxiety, the soldier issue, which is very uncommon in my outpatient practice. Are there any supplements or caffeinated products that might be doing it? Bacterial overgrowth, and with that, people might have like food intolerance. Like, I can't eat tomatoes or certain spices. That's a big sign you have SIBO and need rifaximin. And then the last is the autonomic dysfunction, and that's what our protocol basically is designed to fix. So I hope that helps everybody. Remember to click on the subscribe button, and I'll see you in our next video. Bye.